All right, so we are now recording. So thank you again for joining us today. So today we have Ms. Sheila Clark with us. She is the president and CEO of California Hospice and Palliative Care Association. So I'm going to turn things over to Sheila, and thank you for presenting today.
Thank you for having me. And going forward, I'm going to refer to California Hospice and Palliative Care Association as CHAPCA. It just rolls off the tongue a lot easier, not such a mouthful. And again, thank you for having us. So and I want to, I've done these presentations before. I've talked to lawmakers, federal, state, and we're framing it going forward as CHAPCA's commitment to our constituents who we consider here in California. Which are patients and families and our providers. So a little bit about CHAPCA and our commitment. We are a 501(c) charity. So we are a public-facing, first and foremost, educator to the public on hospice, palliative care, serious illness. And part of that commitment that we have seen in the last few years and in partnership really since 2019 is our commitment to beneficiaries and their to access the highest quality hospice and palliative care in their final days. It is a great benefit. It is the richest benefit underneath the Medicare umbrella of services and Medicaid umbrella of services. And unfortunately, we have seen just an insurmountable amount of fraudulent behavior. And we believe we have a commitment to mitigate that for beneficiaries. And it also has an impact on our hospice providers. So part of that commitment is we want to help identify fraudulent behavior through the beneficiary consultation. And in working with Senior Medicare Patrol, CalHealth Advocates, and other groups, we are able to identify that, right? Because what I call is we peel that onion with the beneficiary. And I was just on a call with CMS before I jumped over here to do this presentation and told them, and we'll discuss it later, Anna's story with her mom. And how did it happen, right? When you really take time with the beneficiary, with their family, and you peel that onion and you figure out, how did this fraud start? How did I get tangled up in this, so to speak? We also use public information from CDPH, the California Department of Public Health, CMS, to connect these dots and identify patterns and trends that could point to fraudulent behavior and say, this physician, this hospice, this lab, I mean, it's all connected through the dots. These, you want to take a look over here because we can name fraudulent behavior. We know that it's fraudulent, or hey, you should take a look over here. So in our work with Senior Medicare Patrol, CMS, state licensure bodies, and the MACs, what we call the Medicare Administrative Contractors, that are pay the bills, so to speak, for CMS and process claims, they're called MACs. And ours here in California is National Government Services. So we're always sharing information, and then we're thinking about, okay, we have this information, now what's the solution? How can we help the beneficiary untangle this mess and get their benefits back? Because if you're enrolled in a hospice fraudulently, and there's a couple ways that can happen, where they steal your the Medicare beneficiary's number, the MIB number. They just get it somehow and start billing. But when that happens, this is the only benefit underneath Medicare where if a fraudulent election is sent up to Medicare, it turns their benefits to the off switch. And we're going to talk more about that and how that happens as we roll through this presentation. Additional commentary on our commitment. We want a process for removing the hospice enrollment when enrollment is fraudulent. We have concerns that the beneficiaries are waiving their rights fraudulently to their other benefits. What we see is that election is sent up, and this is a very complicated benefit, and I'm trying to give you guys as much low level, but it is extremely tangled, a mess when this happens. So when that beneficiary's election goes up, their benefits go to there's literally a switch that they say, okay, this beneficiary has elected hospice, so all the other services are done through the hospice, all their services, so they do not have access. It could be when I go through Anna's story, I'll tell you, I've had beneficiaries where they couldn't get their cataract surgery because the surgeon's like, you're on hospice. Well, you shouldn't be having cataract surgery, or you can't get this medication, you're on hospice. So we're going to talk about that, but our commitment is to how do we get that enrollment removed, and we're working at a federal level with CMS on this, and then also for Medi-Cal at a state level. Overwhelming growth in hospices. In California, Arizona, Nevada, and Texas, we see these fraudulent actors, scammers. We like to call them scammers. We are tracking the addresses of the Medicare certified hospices, more than 60 at one address, where we're asking the federal program and state, who's checking on this? Are you even questioning this? This is not normal behavior. It is not. Physicians serving as a hospice medical director when their license has been suspended. They're indicted, not convicted yet, and they may be connected up to 70 hospices here in California as their medical director. PICOS, which is a system where all the enrollments go for physicians, will help, but who's checking the credentials and the licensure status for those physicians? So that's our commitment. We are asking the federal government, we are asking our state government, who is checking this information? There has been a deactivation process in place since 2006 at the federal level. Why are our federal CMS, is it not being used for some of these dormant, when we say CCN numbers, we mean certification numbers for hospices. The state of California gives them a license. The federal government, CMS, certifies that license, but they never provide service. Well, why not? It's called the stacking of licenses and the churn and burn. Unfortunately, licenses for hospice and CCN numbers, they're disposable. That's why they have so many of them, because they run it into the ground, they cap it, it's no longer viable, and they go on to the next one. So that's why we're saying you need to look at these licenses and these CCN numbers that are just what we call stale. They're just sitting out there waiting to be used. A little bit about growth here in certified hospices, and we bring this up to the attention of our lawmakers, both at a state level and a federal level. So you'll see here, way back in 1983, you'll see the growth. And right here in 2019 is when it continued to go up and up. And then we put a moratorium in place, right? At the end of this year. And so it started to go down. Now, this is certified hospices. And on the previous slide, we talked about those stale, those licenses that are just sitting out there. So CMS does not consider those licenses that are just sitting there until they become certified, right? So that's where, even though California, we put up a moratorium here in 2020, we put that moratorium for licenses, but because you had all these licenses sitting there, they were issued a license, they paid their fee every year to the state of California, but then they didn't trigger those licenses to become certified until later, right? And look at the growth. And everybody's like, and California's like, well, wait a minute, we put up a moratorium on, I said, yes, we put up a moratorium on licensure, but we had all these licenses sitting there waiting to get certified. So I truly believe that California will keep that licensure moratorium in place. We are not a certificate of need state, so you don't need to prove need at the federal level. But California, I truly believe, because they do not want this to continue, they will keep their licensure moratorium going. And we are writing emergency regulations as part of the hospice audit that was done and published by the California auditor. So let's talk about Anna's story. And this is CHAPCA's commitment to senior Medicare patrol. We work in collaboration with them. If they get a fraud case or a suspected fraud case, we get that referral from SMP, and we can really, what I call, peel the onion with the beneficiary. Because what we see, and I want to make sure you guys understand the different types of fraud. In Anna's story, this is a blatant, her MIB number, Sabine, Anna's mom, her number was stolen. It was used fraudulently. Anna nor her mother never signed a hospice of election. She was in a nursing home. They didn't have a contract with this hospice. Absolutely nothing. But Anna and her mom got tangled up in this fraudulent election. And then the second type of fraud, or what we'll call uninformed consent, is that the beneficiary somehow, or their POA, signed an election, but really wasn't given truly informed consent on what hospice is. And you'll see later on, people are promised a lot of things. Oh, sign up for hospice and you'll get this, you'll get that. They are on the phone and they are talking to a marketer, and the marketer says, oh, we can get you all this stuff if you just give me your MIB number. So that is engaging with a scammer, a fraudster, giving them your information and informed consent unknowingly of what you're really signing up for. So let's pull apart Anna's story. This is, I have permission. I'm just going to use Anna, the daughter's first name, and Sabine is her mom. This complaint came to me, to CHAPCA, from the Senior Medicare Patrol. And we are so very thankful for this collaboration, because we have, CHAPCA, we've really been able to shine a focus and a light on, especially with our state lawmakers and federal lawmakers. So the Medicare beneficiary, Anna, has been in a nursing home since 2010. She has dementia, a very slow decline. Anna's daughter is her healthcare power of attorney. She makes the decisions for her mom. She was enrolled in hospice without Anna's knowledge on November 14th, 2023. Brothers Hospice and Palliative Care in Victorville, California, which is from where Anna's mom's nursing home is about 70 miles. 70 miles from where Sabine lives. And what happened is, after that election on November 14th, Sabine was blocked and said, no, we can't get your pacemaker battery checked and replaced, and no PT because you have a hospice election. So you have the cardiologist saying, Anna, we can't, your mom's on hospice. And Anna's like, what? My mom's not on hospice. Okay, so there that fraudulent election starts. And everything comes to a stop. Your benefits, as I said earlier, they go to the off switch, because an election is sent up and it says on this date, November 14th, 2023, this beneficiary has elected hospice. All services should be paid by the hospice. Okay? To take it a step further, which is just, it's for me, it's mind-blowing. The physician that was tied to the election as the referring physician is this doctor, Barem Tabinian. I know I'm not saying the name correctly. He was indicted for Medi-Cal fraud, not convicted yet, in 2019, and has other court documents that are pending against him. No final action. And it's not in here, he lost his license to practice medicine in the state of California. They revoked his license. Think about that. You have a physician who is tied to a hospice election who lost his license. He doesn't even deserve to have the tag of MD behind his name. How does this happen? No hospice services delivered. The nursing home said, we never saw a hospice employee, and this hospice isn't even contracted with us. In a nursing home, in a nursing facility, skilled nursing facility, for the hospice to come in and provide services, they have to have a contract with this nursing home. There is no contract. Senior Medicare Patrol, they filed, they referred it to us. On behalf of Sabine and Anna, I was given permission to file a complaint with the California Department of Public Health. Before that, I had tried to call the number that was listed. It was disconnected. I had folks go and say, hey, that I know in that area, run by and see if there's anybody at this office address. Nobody's there. So I filed the complaint with the California Department of Public Health. Of course, no answer on a phone number that I had eventually found through Medicare, which wasn't even for Brothers Hospice, was somebody's phone number. And they said, I don't know who Brothers Hospice is, but hey, you may want to call this number. They knew exactly who they were. Department of Public Health goes out. Nobody's home. They're knocking on the door. They email the owner of the hospice. They go, nothing. Nobody is getting back to the Department of Public Health. Anna and myself had numerous conversations with 1-800-Medicare. And it was just, yeah, you got to kind of wait this out. It'll be over in February. And I'm like, well, that's the 90-day benefit period, the first benefit period. So it's really not over. And in the meantime, between November and all this is happening, months, days and days are going by where Sabine's not getting the care that she needs. We were told by program integrity that the only way for Anna was to, maybe we need to change the law, or why doesn't she just sign a revocation? And CPI, program integrity, I'm like, okay, Anna can't sign a revocation for a benefit that she never elected for her mom, and nobody can get a hold of the hospice. They're in the wind. And so between that fraudulent election and February, when we finally kept what I call poking the bear, they finally got the election pushed back, what we call pushed back, through the Medicare contractor, the MAC. This hospice had already been reimbursed $12,500 for doing absolutely nothing. Absolutely nothing. We've also worked with our representative, Linda Sanchez's office. We worked with them and their group because they have an advocacy arm where they can also call, put in a case file with CMS. CMS calls NGS. And that's where we were, because we sent this up to the highest levels. Okay, let's just pull this election back, so this woman can access her services. It was a few days from, I think it was on February 11th. The election was up on February 14th. So think about this. from November 14th through through February, Anna's mom, Sabine, was not getting the care that she needed and that she's entitled to. This is a benefit, and this is something that CHAPCA works on with Senior Medicare Patrol. We either get referrals through them, we have folks that call us directly. So what this has done has sparked a need for change, and Senior Medicare Patrol and CHAPCA are working towards that. I wanted to show you these two examples of just blatant, outright fraud, and pay attention to these. If you guys see this, say something. Identify and report. You'll see that I have the Cal Health Advocates website up here, the Senior Medicare Patrol home. There is a plethora of information on that website where you can go to that website and learn more about fraud, how to guard your card, how to protect, and get the word out. That is something that we're going to be doing in conjunction with our partnership at the Senior Medicare Patrol. So this flyer right here, you'll see it says palliative care and home health. Your health always deserves the best. And here, 65 years or plus, and here's the requirements. You need a phone number, an ID or driver's license, and then we need your Medi-Cal or Medicare number. And you call this number. It's actually the number to a restaurant. And I called and I asked for this person here. And it was like, yeah, I can hook you up. What do you need? And you will get these services. You will get housekeeping. You'll get manicures and pedicures. You'll get a nurse visit, supplies, A&D, that's A&D ointment, shampoo, soap, all these things. But look down here. You'll also get a new TV, a new recliner, medication delivered, carpet cleaning, sheets, pillowcases, all of this stuff. This is giving free things away. All we want is your Medicare card or your Medi-Cal number. Give it to us and you'll get all this free stuff. But what they do not understand is that when you elect these services, when you elect hospice, and they're not even calling it hospice, they're calling it palliative care, your benefits go to the off switch. It is unconscionable that this is allowed to happen. And we're going to change this, and we're going to inform our Californians, our beneficiaries out there, on how not to fall victim. This person, we call this a troller. This person goes from door to door in senior independent living facilities, in hospitals, in senior centers, PACE centers, and hands out this card and says, would you like to get these free services? I can get you all these free services. All I need is your Medi-Cal or Medicare number. And these are fraudulent, these are scammers, and we need to put a stop to it. So guard your card and be on the lookout for these things. So our commitment, again, with CHAPCA and SMP, we have been collaborating on a fraud and abuse project. We call it our DEI project. And what did that consist of? So between CHAPCA, SMP, and CRC, a caregiving resource center down in Southern Cal in the Inland Empire, that valley area, what we did is we conducted listening sessions with a targeted demographic, and we asked them a lot of questions about what they knew about hospice, what they knew about palliative care, how do they access it, a lot of questions. And then we sat back and we listened. And we took a lot of information. We made a lot of notes. We asked if we could record some of them so we could dissect it. later. So what did we learn? We learned that we didn't really know a lot about this demographic that we were saying, okay, they're being taken advantage of. We need to talk to them and find out exactly what it is they know. We learned that they thought hospicio, translated, is they thought it's a place you went to, right? They thought that they were told by these scammers, you don't need to be dying to be on hospice. You don't need a prognosis of 6 months or less. And we took all that back and we dissected it because we wanted to come back and ask more questions, because what did we learn? We dissected it and we went back to this group and we asked more questions about what they knew, about how they access service. What do they consider, a scam? Do they know the difference? So a lot went into developing what we call our toolkit. And we will have this toolkit before the end of the month. It'll consist of English and Spanish flyers, 4 different types of flyers based on what we learned and the information that we need to get out there into our community and have them know the difference between what is hospice, what it isn't, and how to access and how to tell a scam. If you're being, scammed, and this is not, if it's too good to be true, right? Pardon me. So we'll have 4 different flyers. We also will have what we call radio spots. So they can be posted on a website. They can be shared within the community. We're hoping a lot of radio stations will pick them up in both English and Spanish. We also have video spots, TV spots that will do the same thing. We'll explain what hospice is, what it isn't, but also with that fraud aspect and what I always say, and I learned from Senior Medicare Patrol, how do I guard my card? How do I not become a victim to fraud, not just hospice fraud, but any fraud that's out there. So we're so looking forward to that toolkit and being able to deliver that to the senior, in conjunction with the Senior Medicare Patrol. And we plan on just blanking it, through the entire state. I will actually start in Southern California, down a little bit past San Diego, and move my way up, through the Central Valley, and then up here, Sacramento, because that's really where we see the fraud. It is heavy, 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 heavy down in Southern Cal. And we have actually seen it move up into our Central Valley. And even up here, I'm based out of Sacramento, and we're seeing it up here. Not to the degree of what we see in Southern Cal, but we want to stop it in its track. So developing that toolkit, and I am so thankful for Senior Medicare Patrol and them inviting CHAPCA in to help with that and to make sure that we, get the scammers out of our space, or at least affect change and have people become informed to when, what hospice is, what it isn't, and the consequence of either signing that election, not having fully informed consent, or having your number being stolen. So that right now is the end of my presentation, and I would be open to questions if anybody has them.
Thank you so much, Sheila. That was super helpful. If you guys have questions, please feel free to chat the questions in the chat box. And if you need me to unmute you, just chat that as well, and I can unmute.
Nina, can you tell me a little bit about the demographic of the folks that are attending today?
Oh, sure. So these are service coordinators. So AASC is a membership association we support service coordinators across the country. And so the people on the call today are service coordinators working primarily with seniors in affordable housing. So their goal is to facilitate connections with resources so that the residents can continue to live independently at home.
Nice, nice. Okay.
Yeah.
Well, and I can tell you that's when how the connection is that you do have this affordable housing, and that what I was showing you with those business cards, these scammers, because it translates well, right? Our whole project was to focus on a certain demographic who are taken advantage of. We find that these folks go out into those that affordable housing, whether it's apartments, independent living. They target that demographic and go door to door. Right? They go door to door and they say, oh, well, wouldn't you like this? Wouldn't you like this? Medicare offers this. Medi-Cal offers this. And they're like, oh, well, yeah, I would love to have that. I would love manicures and pedicures. I would like a new flat screen TV. I would, yeah. And I can get this. Yeah. All you have to do is sign here, or all you have to do is give me this. And we are finding it more and more where it's the scammers. Yeah, they're even doing what we call it's life insurance scams, right? They'll get these beneficiaries to sign up for hospice, and they're going through the paperwork, and the hospice will slide in a beneficiary form for life insurance. The hospice is going to pay for the life insurance, but the beneficiary is the hospice owner.
Oh, no. That is awful.
It is awful. It is awful. So we are doing all we can to get the word out and educate. And we are so, I'm thankful every day for Senior Medicare Patrol partnering with CHAPCA, because we're more informed together when we can get the word out. And I know that SMP, I know I'll make sure that it's sent to you guys, because we need to get the information out there. We do, to protect the benefit, because what folks don't understand, and until they're caught up in it, Anna's story and so many others that we get referred from Senior Medicare Patrol, is that if you have an election, it is sent up, and that's actually what we call it. We send it up. Your benefit, that go to the off switch, you don't have access anymore, and that can be detrimental. That can cause beneficiary harm.
Yeah, definitely. Well, I appreciate all the wonderful information. It looks like we have a question. I'm gonna give you a mic. I can't see your full name. I'm sorry. I just see your hand is raised. Angelica, I think. Okay, you should be able to use your microphone, Angelica, if you hit unmute.
I don't think she can.
Try. Angelica, I don't know if you can unmute or not, or if you want to chat your question in. I see you raised your hand, but I can't do much more than give you the ability to unmute.
Let me share my screen. Well, I don't want to share that screen. Let me share this screen. So here, if you go to your mic and you click here, and you just unmute from your mic. Or if you're on a desktop, you may not have a microphone.
Yeah, there's that too.
Yeah.
Oh, oh, she took her hand down, so maybe she no longer has a question.
Let me, Nina, share real quick. I was talking about the senior Medicare patrol here, and the website is in the handout. And this is where you can learn a lot about here in California. Protect yourself and your loved one, not just from, hospice fraud, but it's got the examples, news about senior Medicare patrol, the fraud alerts, how you can help. This is a plethora of information that you can give to your customers, right? Your constituents, especially on how to spot it. What are the latest scams? When you answer your phone, don't give people information. So I would make sure that if you guys can, you spend some time here on the SMP website, and then you can also register for additional upcoming education and webinars. But there are just a plethora of examples, and billing, providers commit fraud when they do these things, insurance brokers, there you go, that's the whole life insurance fraud, because we tracked it down to a broker and a hospice owner. And I always say you can't make this stuff up. So guarding your information, not giving it out to anyone. If anybody calls on the phone and says, "Oh, I need your number for this," or you only give your number when you're in front of somebody, you're at a hospital, you're at a physician's office, and you give them that card. You should never be asked for it at any other time, in front of a pharmacist. Only when you need that service. Only when you need that service.
Perfect. Thank you. I did just get an email from someone. It seems, at least for this person, they're unable to chat for some reason. So that may be part of the problem. I did have a question for you really quickly while I'm trying to figure this out.
Sure.
So you mentioned the toolkit. Do you know when that will be available?
We will have that delivered to us within the next few weeks. And
Okay.
we get that out to everyone and anyone who's willing to help promote it. And it'll be in English and in Spanish. And CHAPCA, what we're looking at is based on where I'll go is, do I need to get it into another language? Right now it's English and Spanish because that was part of our project in that specific area. But we truly believe it can be used across the state and in other states.
Right.
Yep.
That's what I was thinking. It would be helpful. If you can send that to me once it's available, and then I can definitely share that with our members.
Absolutely.
Oh, well, somebody just chatted.
Oh, I did. I say you can chat here.
Yeah.
But Nina, just know that if you can share my information in the presentation that and send it out, and if any of your members, if they have questions, reach out. They can go through you. They can go through me. Even after this, we're here to make sure that we're getting the information. Okay, I just seen one. How can we get the kit after you receive it? Nina, I'll make sure you have it in your hands, and then you can distribute it.
Yeah, definitely. I will send it out to all of you. So Angelica just sent me her question through email. She said, do hospice benefits fall into waiting period when unenrolled?
Not waiting periods. The way that the benefit works is when you first elect hospice, there's one 90-day period, a second 90-day period, so 90, 90, and then ongoing 60s, what we call 60 days. So if you were to come on hospice in that 90 days, you can come off hospice at any time. The beneficiary or their POA can revoke that hospice benefit. And then say you did, then that first benefit period has been used, right? So if you ever re-enroll, you're in that second benefit period, and so on. Then if you go to the next one, you're in the third, the fourth, and then you come off of hospice again. So that you, and for Medicare, then you would re-enroll in a benefit period down here, right? A fourth benefit period. So it goes into periods, is what we call the benefit period. So once you use one, one is used. You go on to the next. But you can stay on hospice as long as you the patient continues to decline and show that terminal decline, right? They're not you can't be chronically ill and on hospice. You need to be terminally ill and be on hospice. And people don't die on a calendar, right? None of us have an expiration date on the bottom of our foot. We need to show decline. It is the hospice's job to show decline.
Perfect. Thank you. If anyone else has any questions, feel free to chat them, or if for some reason the chat is not working for you, it may be a company, like your company's restriction, since it's an outside
if it's an outside
meeting.
They'll put what do they say? They'll put the bars up, or the
yes
this way.
Yes. So if you can't chat, feel free to email me and I can relay the message that way. And I will put my email in the chat really quickly, just so that you guys have it. Try to spell it right. Yes. Okay. So for the sort of back to Angelica's question. So if somebody is in hospice and they are no longer declining and are able to get off of hospice care, if they get off, but then something happens and they start declining again and they need to go back on, if it's within that same, what you're calling benefit period, is that
next period? So say
okay, so there's no overlap.
Yep, it's benefit period 1, 2, and then ongoing, what we call 60-day periods. So it is, I guess, a use cycle. You use number 1, number 2, number 3. I come off, and then if I come off in number 3, I can go on to number 4. I'm in the fourth benefit period, right? And if you revoke, it's the same thing. If you discharge, now you can also transfer to another hospice in a benefit period once. So say I'm in XYZ hospice and it's just not going well. It's not a good fit for whatever reason, and I want to transfer to hospice B, then I can do that with no lapse in that benefit period. But you can only do that once. But there's a few rules around that. But the good thing, the way the benefit was designed, is you can continue to receive services, and the benefit periods are more for the hospice to keep track of and tell you, okay, mom's in the first benefit period, the second. It's more for them to keep track of, so they know. All right, because there's certain rules they need to adhere to when it's in that first benefit period, second benefit period. For instance, when you first elect hospice and you're in that first 90-day benefit period, you need 2 physicians to certify verbally and in writing and through documentation that patient has a life expectancy of 6 months or less if the terminal disease and related conditions continue to show decline, right? So 2 physicians to start in that 90-day benefit period. Once you go to the second 90 and ongoing 60s, it's the hospice physician and the team that are showing up, seeing the patient, and documenting that, yeah, this patient is continuing to decline. Now, in so many what we call disease processes, you either see a sharp decline or what we call sawtooth. It'll go up and down. For Alzheimer's and dementia, you see it goes like this and then drops and then like this, right? It's more what we call a plateau and a drop, and then though it's really making sure that you're watching and talking with the family about what's going on, right. and listening to them, because you have all those nuances where in a decline can be something, and we don't really think about this, right? Because for us, it's always in the medical field, and I was a clinician way back, is we're documenting, oh, look, they're getting better, right? You're documenting that they're getting better. In hospice, you're documenting the other way. Right. And as clinicians, we're really not taught that way, right? We're taught, oh, it's all it's all these, they're getting better. Well, in hospice, you're documenting the decline, and little things that can show decline is nutrition. I used to eat 3/4. Now I'm down to half, and now I'm down to 1/4. That is decline. I used to be able to, cut up my chicken. Now I have to have it pureed because I can't swallow it. So those are little things. I used to be able to participate. I used to be able to get up, dress myself, take my shower. Now, not so much. I can't do that. So we call those activities of daily living. I need more help with those. And then I'm totally dependent on others. So those are all things that the hospice is looking at to make sure that hospice patient is appropriate for hospice.
Perfect. Yes, I recall that.
Yeah, very complicated benefit.
Yes,
but
yes.
A necessary benefit, and it is the richest benefit under the Medicare umbrella. It is paid for at 100%. There is no out-of-pocket cost for the beneficiary, and they get medications, they get supplies, they can get HME, DME equipment, a hospital bed, an oxygen concentrator, a bedside commode, a chair, a shower chair, a walker, a wheelchair, whatever it is they need, right? To bring them comfort and to make sure that their symptoms are managed. And they take care of the entire family, right? Not just the patient, it's it's that circle of care.
That's awesome. That's awesome. So we do have a few questions. I got a couple in my email just a second ago, and then it looks like Michelle messaged, what organization will come out and do hospice presentation at her property? I don't know if you know the answer to that question.
We can do that, Chapka. I was just at a senior center the other day, and absolutely, we would love to do that. You can just contact us. And as I mentioned earlier, we have a stipend for travel if it's outside of, my Tri-County area. Yeah, absolutely. We'd love to come and provide that learning session about what hospice is, what it isn't, and how to not fall a victim to fraud and abuse.
Do you want to throw that contact information in the chat just in case they didn't jot it down from the presentation slides? And then the other question I have says, what about I cannot say that word. What about palliative care? Is that part of the 90 benefit period, or is palliative care benefits different?
Okay, so palliative care is hospice care. To palliate means to manage symptoms, right? Palliative care underneath the Medicare umbrella, there is no reimbursement or a benefit, like there's a hospice benefit. There is no palliative care benefit underneath the Medicare umbrella. Underneath the Medi-Cal umbrella, Brown, we worked on that and signed that into law, years ago. So under Medi-Cal, there is a palliative care. Under Medicare, there is not. It's not reimbursable. There's a what we call palliative care light, that there's some services you can get if you're on home health. But there just isn't a palliative care benefit right now. It's something we're working on, something we're looking at. We're asking, federal lawmakers, we need to do something, because it's a broken bridge, right? Palliative care is up here. It's more upstream from that 6-month prognosis. So you have those folks that are up here, and then you have your hospice folks that are eligible to get the benefit. But what are they doing? They need services between palliative care and hospice care.
Okay. Definitely. Thank you. And then we have a follow-up question. It says, what if a patient does not show decline over a long period of time? Does it get flagged by Medicare?
Yes, it does. It can. And you can be subject to audit. We call those ADRs. And a hospice really needs to focus in on that. And if they see that that beneficiary is no longer declining, you never want to what I call blindside a beneficiary or their family and say, oh, no longer appropriate. It's an ongoing conversation. And you're saying to them, okay, you can see that dad now is not, this is no longer happening. This is managed, his pain. He's able to do this. So that decline has subsided, right? And it's a hard decision for your good hospices out there, right? Because they know that the family needs care. They need something. So before you discharge, you want to make sure that you're providing that family and that patient with all those needed resources, right? That if they have to come off hospice, that you're preparing them for that. And here's where you can access different services, making sure they're staying in touch with their primary care provider. What else can we help them get? Here in California, are they eligible for in-home supportive services? Maybe that's a great benefit that we have here in the state of California. So that's the hospice's job, is let's make sure that if we have to discharge, and it happens, we call it graduating from hospice, that we are getting them as many services around them to help if we have to then discharge. But a good hospice is always going to ask permission. Can I check in with you in a month to see how you're doing? Can I check that? Because we want to make sure, because usually what happens is it's that plateau period, right? And and you can watch them for a little while, but if they are no longer appropriate, you do need to discharge them from hospice care.
Wonderful.
Then
Thank
always
you.
check back. Always check back with them.
Definitely. And then we had another question in the chat. And I don't know, do you guys serve the Northern California area? This person's looking for someone to do a presentation, but they're in Northern California.
I'm in Northern California. So whereabouts
Perfect.
in Northern California?
They do not say.
Okay, well, I put my information in the chat. Please reach out to me. And yeah, we can go from the border down to the other border, all of my border states, right? Because I serve California. So yes, we would love to be part of, American Canyon. Yes, Napa County, I know exactly where that is. San Francisco, yes, Michelle. Just reach out and I will be there.
Wonderful. Thank you so much for all of your time and for answering all these questions. We really appreciate it.
No worries.
And then when you get the toolkit, feel free to send it my way and I can get it out to everybody.
We are so excited about it. And I'm so excited that, CHAPCA was asked to be part of this with Senior Medicare Patrol. I think it's going to make a big difference in California.
Yes.
Yeah.
Well, thank you. I appreciate it. Thank you, everyone. Have a wonderful day.
Bye, guys. Have a good day.